Namaskar. Welcome to yet another very important session in the 2 day mega virtual healthcare summit, that is IndiGlobal Healthcare Summit, that is will be continuing for today and tomorrow. IndiGlobal Healthcare Summit will see and has seen policymakers, leaders, innovators, and experts from across the country, from the healthcare sector, and participating in vibrant sessions, including power packed panel discussions, leader talks, recognition and awards, and also workshops. And today, this morning, we had an amazing inaugural session with participation from Government of India, Ministry of Health, and National Health Authority Executive Director, Dr. Sudha Chandrasekhar. And we also had representation from the Government of Kerala and also Government of Telangana. Government of Kerala, Dr. Ratan Kelkar, who is the Mission Director and also the executive director of our health agency, Government of Kerala, and Health and Family Department. And we were also joined by Dr. Uh, Harichandana Dasari, who's the uh, district magistrate and collector within Narayanpet district. They have given various initiatives and they touched upon very important subjects, that is evolving landscape in the Indian healthcare system and the road ahead, accelerating healthcare delivery through technology, upskilling in healthcare sector, investments in healthcare sector has been some of the important topics that were discussed. At the same time, we had some important following that we had award ceremony and recognitions. After that, we had yet another panel discussion that was on redefining, that is the evolving, uh, changing dynamics of digital healthcare. And we had leaders from across the country who participated. And after that, redefining diagnostic landscape. And now we are in yet another important session, that is the impact on heart health in the times of COVID-19. We have seen rise in cases of sudden heart attacks in young and middle-aged, management of heart diseases and identifying underlying diseases, role of teleconsultations in heart health, increased and further reliability of diagnostic tools to monitor cardiac problems are the points upon which our esteemed speakers, clinicians, heart surgeons who have joined us as the esteemed speakers would be touching upon. At present, we are live through a 3D virtual platform. Many delegates from across the country have registered and are watching us live. At the same time, we are also live streaming from several social platforms, which includes LinkedIn, Facebook, and YouTube. So I welcome everybody. This particular IndiGlobal Healthcare Summit is being hosted by IndiGlobal Media Network that takes innovation, collaboration, and growth to the forefront, and powered by IndiGlobal Edge Factor that brings to you deep insights, scientific based and research based from the healthcare leaders. So without further ado, I'm joined by my colleague Kaniza Garari, who will be co-moderating this session with me. With this, over to you, Kaniza.
Thank you, Sudhir. Welcome to all our esteemed guests. A very warm good afternoon to all. And heart, a healthy heart is the basis of a healthy living. And if we have to live long and live well, we must ensure that our heart health is well taken care of. With that note, I invite our esteemed speakers, Dr. Amrish Rao Malampati, Senior Cardiothoracic Vascular Surgeon, NIMS Hospital, Telangana. Welcome, sir.
Hi, welcome. Always happy to be in your show.
Thank you, sir. We also have with us Dr. KMK Reddy, Senior Professor Cardiology, Usmania Medical College, and Senior Interventional Cardiologist at Apollo Hospitals. Also, President Cardiology Society of India, Telangana. Welcome, sir.
Namaste.
Welcome.
Namaste. Thank you.
Namaste.
Thank you to part of this prestigious program.
Thank you, sir. Thank you. We have with us Dr. Brajesh Kunwar, Director, Interventional Cardiology, Fortis Hiranandani Hospital, Vashi, Maharashtra. Welcome, sir.
Welcome, Dr. Brajesh.
Welcome, Dr. Brajesh. We also have with us Dr. Pradeep Haranhali, Direct Interventional Cardiology, Manipal Hospitals, Bangalore. Welcome, sir.
Thank you. Thank you.
Welcome,
Glad
Dr.
to be part of this summit.
Thank you, sir. So as we have esteemed speakers, doctors, and senior surgeons with us, we are going to discuss uh, the heart health conditions in India. Before the advent of COVID-19, there was a wave noticed where we found that a lot of young people were suffering from heart attacks. And we saw a major increase in the incidence of young heart attacks. This was something which was not noticed. And as we slowly, as the pandemic struck us, there were incidences where there has been a huge jump in sudden heart attacks. So today we are going to discuss about the heart health pre and post COVID, and what is it that people must keep in mind, and how must heart health be managed. So my first question is to Dr. Amrish Rao. Sir, how do you think is is the management of heart in terms of people, as well as when do people come with their heart problems to the hospitals? Is it at a very late stage that we see them drawing attention, or is it that we find that yes, some of them are proactive and are very health conscious now, so they are coming on time to the hospitals?
If you would like to me to mention in with the view to the COVID waves which we had, definitely there was a reluctance of people to attend the hospital during the COVID times, and
Yes.
we did see a lot of patients who presented with complications of heart attacks because they were just reluctant to come to the hospitals. But post COVID, as you have mentioned, uh, there have been certain instances where it has come to light that young people have suffered heart attacks, especially Puneet Rajkumar and our Honorable Minister Mekapati. That has really brought to a lot of focus the attention of heart disease in young people. And this has been a unique feature of India. And in fact, at NIMS, we have been studying these patients who come for triple bypass at such a young age, less than 45 years. We have studied, in fact, and we realize more than 75% have two or less than two conventional risk factors. So being an Indian itself is a risk factor. Of course, our people, while a category of people do screen themselves for heart disease or risk factors, a lot of them, especially at a young age, don't really. I don't think many people don't even have the concept of a heart healthy lifestyle, and a lot of these patients present to us with heart attacks and complications with severely compromised function. So in that way, we are looking at a very alarming trend in the country. And another thing I would like to add, there's a small category of patients who just say, I want to get all the tests done, and once those tests are normal, instead of being thankful that they have a healthy profile and then investing in a healthier lifestyle, I think they revert back to unhealthy lifestyles, which doesn't really make much sense. I'm sure the cardiologists will also throw much more light on it. But as surgeons, when we get typically younger patients for surgery, the typical presentation is heart attack. Of course, the nature of disease is like that, and the typical presentation is quite late, and many of them are detected to have risk factors at that particular point of time.
Okay. So my next question would be to Dr. Pradeep. Sir, how young are the patients? Meaning, as we see, under 40, under 20, or and what is it? What are the risk factors apart from uh, lifestyle diseases, smoking, alcohol? Is that one of the main reasons why we are seeing an increase, or it's just too much of sitting next over the computer? Is it something like that?
Uh, Classically, we know what we call as first line risk factors for atherosclerotic coronary artery disease. Uh, we typically talk about smoking, hypertension, dyslipidemia, diabetes mellitus, and then we have second line risk factors. Apart from all this, yes, we can go on adding physical inactivity, obesity, unhealthy dietary habits, etc. Um, when you ask about the age group, yes, we all agree from our own experiences that we have seen a trend of uh, uh, people getting affected with heart attack at lesser age. It is not new to India. It is not new to us. We always seen youngsters coming with heart attacks, but we all agree that there has been a slight increase in trend with the maybe in the past 1 to 2 years that we have been through COVID. And we would say it is more an abrupt surge in the numbers of young age heart attacks. And this has been catapulted with multiple celebrity, tragedies, which is in limelight in the forefront, which further, I would say, sensitized our population at the same time has put into panic as well.
Okay, sir. Sir, but do we also have any kind of data when in which tells us what would be the reasons? Meaning, if young people are getting heart attacks, is there any kind of understanding that why is this young group getting prone to it? And what as the risk factors are mentioned, but are we having any back-end studies, especially per se Indian population? Because Indian demographics also are different. Like state-wise, the populations differ. There are different eating habits. There are different lifestyle methods which are followed by everyone. So, is there any baseline that we can say that yes, we see this as the major reason?
As Dr. Amresh pointed out, yes, we as Indian in itself, I mean, being an Indian in itself is a risk factor. So, on a larger scale, we talk about Asian population being prone by at least 1 decade earlier compared to Western population. So that foundation is already there. So on top of that, if you look at what do you call the spending ability of our population or cash flow in our hands, so life has become much more simple. Affordability has improved. Eating habits have changed to the tune that there is more unhealthy pattern of eating, as well as lack of physical activity, growing obesity. Well, sitting at Bangalore at the hub of IT, I look at people who come to us who spend 14 to 16 hours in front of laptops without moving, and that too on top of that with improved door delivery services, so you don't have to step out at all. And that was further worsened by lockdown and so on and so forth. So I would say to an extent all this could have added, and the stress of a pandemic in itself. And well, it's difficult to authoritatively say, but what we can comment is only the change in trend. And we all, from our personal experiences, my fellow colleagues do also have similar observation. And it's not a rarity now anyone saying my friend collapsed suddenly, or somebody known to me who is so young, I had met few days back, collapsed suddenly. I mean,
Yes.
until proved otherwise, these are all regarded as sudden cardiac deaths.
Yes, yes, very true, very true. So it's very clear that there are issues which are being sudden heart attacks and sudden cardiac arrest is a reality. So, my next question is to Dr. KMK Reddy. Sir, how do we see ourselves in the next 10 years in terms of heart health, and what is it that people must do, or what is it that the cardiology community thinks is important that people must follow? There are a lot of awareness programs, there are a lot of camps, there is a lot of talk on, how healthy one must be. So, what is the way forward? If Indians have to be healthy, and as Dr. Amrish said, if someone comes and in the checkup they are absolutely fine, then they just divert to unhealthy lifestyles. So, how and in which way can this behavioral change be brought out?
Yeah. I think before answering your question straight, I just want to add that there is one study by name Interheart study conducted, I think, more than 15 years ago, covering the South Asian population, wherein apart from the conventional risk factors like diabetes mellitus, hypertension, dyslipidemia, smoking, high BMIs, and the important highlight in that study was the psychosocial factors. That is something called a stress factor. I think our colleague Dr. Pradeep has already mentioned the stress by many, many ways has multiplied, I can say, in the last few years, not only in India, everywhere, but more so the worse in India. And the WHO has warned or alarmed the country like India that the majority of the young population are going to be hit by 2020 itself. And they also mentioned by 2030, the stroke in young or so-called acute myocardial infarctions in young population in India is going to be a tune of an epidemic. Unfortunately, we are already witnessing that tragedy and the story about it. And having understood all these things, probably it is the duty of our every cardiologist and the stakeholders of the cardiac treatment, including the surgeons, and probably many healthcare delivery system or the owners of that and other allied people, wherein we need to know what is the science that is available, and at the same time we have to put the science into practice very strictly, very strictly. There is nothing like a probably compromising on certain aspects and giving a lenient attitude, so that probably we can avoid, if we are very strict and very sincere and honest enough to practice the science available. I'm talking in reference to the cardiac health, heart health. Definitely, there are a lot of ways that the society has to be educated, and probably there's something called a 360 degrees of view should be taken from all the stakeholders of the system, and every citizen has to be educated and has to be imparted the scientific knowledge about a prevention of diseases to the heart, mainly the heart attacks. In the recent past, we have seen many important VVIPs are being hit by this tragedy. And as our colleague was mentioning, it's one way good that they have given some message to the society that it is possible. And at the same time, we lost many important people and which are having a lot of future to this country. Just because it happened in the some VVIPs, it doesn't mean for a treatment purpose, it doesn't change anything, but it is a big signal for every one of us that we need to take care of our own health, and probably we have to take care of the health of the community at large. For this, definitely, there are a lot of interaction, a lot of education has to be taken place in the consultation chambers itself. It is not that the consultation chamber is meant for only prescription. No, apart from the prescription, probably every one of us should feel a responsibility more than the duty that we need to educate our own client about the preventive aspect. It's a fancy term that the preventive cardiology, I know that, but it is a very, very serious term now. Until unless we prevent it as a part of or adjacent part of a cure or the palliation, whatever we have been doing, probably we are leaving a very, very a bloody pathway or a nasty pathway for our future generations. So one is educating the real health, regarding the exercise aspect, regarding the diet, regarding probably how to screen for the conventional risk factors, including the so-called family history. Many a times family history is being masked. We don't go to the family history very seriously. As a passing mention, many of us will ask, do you have any family history? Then the many people don't understand what is exactly the family history, and they tend to say a family history of diabetes, family history of hypertension, family history of asthma, something like that. So we have to ask very specifically. We need to spend some time in educating and getting an accurate, correct information from our own clients, and spread this new message through social media or media. Probably our policy makers also should be influenced in a positive direction, that a lot of periodical medical health checkups has to be taken in the population. Give a correct message, an authenticated message, rather than leaving the people on a rumors or some alarming panic situations like that. So there are many ways. I think probably our time may not be sufficient to talk all those things, but broadly, we have to educate the people on heart health, more so on the preventive aspect, apart from managing the own risk factors. Thank you.
Yes, thank you. That's a very important point, sir. And many a times people don't understand the signs also. There are so many people who say that, they had their arm paining, or they had certain kind of symptom, but they never understood it and they never went to the doctor. So that is also one of the major challenges that they face. We would also like to understand, how has telemedicine worked in the last 2 years in terms of managing heart diseases, the existing patients which were there, and how has it helped in taking care of these patients? My question would be to Dr. Brajesh Kunwar. Sir, how has telemedicine helped in managing heart diseases?
Yeah, so I think it was a great help, especially during pandemic time. Now, when the pandemic initially started, there was a lot of panic and OPDs and all were closed. Our patients were not in touch with us, and there are many patients who started running out of the cities and going to their villages. So there was always a problem, and cardiac patients who are particular on a particular medicines like anticoagulation, antiplatelets, they cannot be stopped. So we did had a lot of problems in initial few months, where we were trying to sort out how to be in touch with these patients. And importantly, these patients were so scared that they will not show to the even to a local doctor. So they were sitting at home, their medicines will get over, or they may have a problem in understanding new symptoms, and even the new symptoms, even if it comes, they will not report it to anyone. So we were facing this problem. Once we started, or once this concept of telemedicines took a good pace, we come and started contact with our patients, and the benefits were, you can see your patients, you can actually virtually examine the patients, you can see if there's a pedal edema, pallor, you can tell the patients to record their blood pressures, you can record their pulse rate, saturations. And once the patient sees you and you see the patient, it seems the patient gets more faith, and he starts understanding, and you also starts understanding what the issues are. And on top of that, you can write prescriptions, you can so justify the communication between you and the patient through telecommunication. So there was a time when we started with 1 or 2 telecommunication a day, and then it reached around 25 to 30 in a day. So that has really helped the patient, even patient sitting in Patna, or patient sitting in deep inside a Maharashtra village, or deep inside a Bihar village or UP village, or anywhere, any part of the country, started showing us. And we do had calls from international patients, and that has really helped us, and making the patients look. I think this is way forward. The future will have the similar issues. Now, see, we used to have patients who will tell, "Sir, I am going to leave Maharashtra, Mumbai. Now I have been posted now to Himachal Pradesh. How I am going to follow up with you?" But that concept is now over. Even if they go to Himachal Pradesh, and they can still follow up with you on telecommunication, and that is the best part of this coming telemedicine advantages. So I think it has really helped, especially in pandemic time. We have done justice to our patients, and it worked well, and still we are continuing it.
Yes, that is definitely there, sir. Because that has actually helped. But how do you manage? Now, suppose if a patient is coming in with a severe disease, then was the EICU system available, or was there a connect? And is there a coordination between hospitals where a patient sitting in a remote village or probably in a city or a metro city can be contacted, and two doctors can talk to each other, and the treatment can be done? Was that also experienced during these times, sir?
Yes, absolutely. Yes. See, in cardiology, the most important is to go through the ECG, the investigation. So that was very very important. So we do help patients sitting in a periphery. In fact, not to forget about the periphery. Even in our Mumbai city, I was sitting in my hospital, and few of my patients were admitted with a COVID infection in a local peripheral hospital. And when they had some ECG abnormalities, we connected through telemedicine and we sorted out everything on phone. So definitely it has helped us. And the ICUs can be managed. Their small centers can be connected to a bigger center. We had this facility available here where we were catering few smaller centers, and it really helped, especially in cardiology, because the time is very very important. You
Mm.
cannot wait for it. As my fellow cardiologist will agree that the timing of thrombolysis, timing of giving a particular medicines, antiarrhythmic drugs, and all those things makes a huge difference. Timing of giving a Lasix to a patient makes a huge difference in mortality and morbidity. So that really helped us, and we were doing that, and it went very successfully.
Yeah, and your experience in Mumbai speaks, sir, because Mumbai being such a big city, if you get stuck in a traffic jam, maybe you never know when the patient will reach the hospital. So if he
Yeah.
can be managed in a peripheral area, then it does speak a lot. Yes, it does make a difference. We would also like to understand, how has long COVID panned out in heart patients? My question would be to Dr. Amrish Rao. Sir, how has long COVID impacted heart patients or those who were suffering from heart diseases? And how long has it taken for a patient to recover when they were found that their heart was affected because of COVID? Sir, you're on mute.
As the name itself suggests, long COVID is the patient is taking quite some time to recover from the complete impact of COVID itself. Now, we have a lot of patients who are under long-term follow-up. We realized that a lot of these patients had stopped coming to the hospitals. So their parameters were all out of control. A lot of patients who suffered from COVID, who underwent treatment, especially those who especially those who had a dose of steroids and all. A lot of them had altered blood sugars. A lot of their parameters were way out of control. A lot of these patients had virtually given up on any physical activity. They were not going out for fear of getting COVID again, or they were not in a physical position to actually go out and exercise. Then not only that, then they had issues with the lung. They had breathlessness, severe cough. We couldn't many times we couldn't quite figure out whether it was because of the cardiac condition or whether it was because of the lung condition. So there were a lot of these gray areas. Uh, so if you put together the entire scenario, where the cardiac condition and the lung condition, and then there are these inflammatory conditions, all of them put together, definitely lot of these patients have had a very, very tough time in the past couple of years. Uh, they're taking long to recover. Rehabilitation has become a very big issue. As it is, cardiac rehabilitation is a very neglected subject in India, and COVID pandemic entailed cardiopulmonary rehabilitation, and so it has become very tough for these patients. We are still seeing patients slowly limping back to normalcy, but it would take some time before they are perfectly normal. As Dr. K.M. Reddy sir said, the entire society has to be educated. Uh, and as Dr. Brajesh said, probably telemedicine would help us a bit more in getting these patients back to track. But yes, we are facing a huge problem where a large section of society is just plain unhealthy right now. They are not at anywhere near their full functional capacity. It is way out of proportion to their age, to probably even the condition they have when we actually examine them physically. And it is way out of proportion to what it should be.
Okay, that is quite an alarming thing, sir, because many of them are not even aware that they are not really well, and they may not even, because they, after a point, they would want to just get. It has been noticed after Omicron that many people just want to keep themselves free and believe that they are in the pre-COVID times. So that is also another challenge which we are facing. I would also
Absolutely.
like to know, sir, from Dr. KMK Reddy, what about children who suffer from heart diseases? There are children who come with congenital diseases. They are the ones also who have been having this problem. So, how were these children managed during COVID-19 times? And post that, what is the development and how are these cases being managed?
See, like in any disease, wherever there is some immunocompromise component, whether it is a heart failure, for whatever the etiology, including the coronary artery disease or hypertensive heart disease, whatever. So even the congenital heart disease, the people who have been suffering from a so-called a heart failure component or the class 4 symptoms, including the children, are the cyanotic congenital heart disease, where there is already some amount of desaturations are there. These people were definitely prone for more infections when compared to normal population. There is no second thought or ambiguity about it. But here, I mean, the interesting thing is, COVID can infect the anybody, anybody in even the heart. At the same time, the heart disease already sufferers may have little proneness or a potential candidate for an infection. Both components are there. Once they have a congenital heart disease in children, or when they have some amount of desaturations in the form of cyanosis, or when they have a heart failure component, all these popular, I'm just mentioning some subsets, these people definitely are prone for infections, including the COVID-19. So these things adversely affect naturally because the COVID infection can directly influence the heart or can indirectly also influence the heart. Direct influencing is it can infect the myocardium, whether it is in children or in the adults. Indirectly, when there are something like, let us say, fever, and then the fever produces tachycardia. Tachycardia worsens the heart failure, or the immune depletion itself, or the cytokine storm can affect. So these are all both direct and indirect ways. It is something like there is a lot of hit, major hit happened even in children who were already having a heart issues. But this was a reality. Probably I can say whether it is a natural mechanism that happened or a protective mechanism that happened, somehow or other, when compared to the some of the Western studies, when it is compared, our children definitely got less infected, and that is the only blessing that happened. But definitely, certainly, there was a damage happened. I mean, this is quite explainable, and there is a scientific reasons to happen like this. And the panic mode of the entire society during the pandemic has caused a lot of damage in a negative way, because they just confined everybody confined to their home, and they thought probably better to not to go out of the home. Let us take the toll, whatever that happens decides by the almighty, something like that. There are many feelings happen, emotional upsets, emotional imbalances happen, and some of the so-called mortality were not notified also, and some of the diseases like morbidity or the sufferings, they did not come even to the hospital. There are many stories, and the things happen slowly. They are now coming out of all these things, and people trying to come to the consultants, and now they are sharing their experiences. There are some families where 50% of the family members were not existing. This type of stories are there. This is a reality. This is a truth happened even in a congenital heart disease suffering children too.
Okay, that is quite a serious thing, sir. And yes, panic was one of the most important factors. The kind of anxiety attacks that people had has actually got many of them to understand that yes, they were suffering from anxiety. So my next question goes to Dr. Pradeep. So when we find that people are suffering from anxiety, often they feel that they're getting a heart attack and they want to rush to the hospital. Did you all ever see cases like that also during this period where the anxiety attack made them panic and come over, and later it was understood that it was not a heart problem but it was a problem of the mental health, and that they were just going through a panic or an anxiety attack? So, say you're mute.
We always had patients coming by with varied presentation. Uh, on one extreme, you had people who, you know, uh, falsely believed they are fine, ignored actual symptoms, and on the other extreme, you had people who kept rushing to hospital, even for the slightest or the subtlest symptoms. And we saw this extreme whenever there was a celebrity death. We saw people rushing to hospital even for the minutest symptom, which probably they never recognized or even ignored in the past. And it was so much to the extent that people even carried CT coronary angiogram reports to OPDs, self-advised. And uh, well, it's not that they should be blamed for this, but the key lies in the spectrum with which heart attack can strike. On one extreme, we know silent heart attacks, wherein you catch people much later when they come to you for some other reason. You see their ECG and ask them, "Have you ever suffered a heart attack?" And they are clueless. They say, "I never had anything." But on the other extreme, few people don't even get 5 minutes to reach a hospital. So this is the widest spectrum you can never imagine with which the heart attack can strike. So how can you expect common public to gauge what is important and what is not? So uh, but then, as Professor Reddy pointed out, the onus lies on us to educate them to some extent, explain them what an actual heart attack looks like, uh, what is important and what is not, in possible simple words. And we used to see a sudden surge of patients, youngsters rushing to hospital uh, episodically post reports of celebrity mortalities.
Okay, okay. So we that would have been that just it was like an action reaction kind of impact that has been seen. While heart is an important subject, and it does often people are not sure as to what are the signs, and since signs are different, many of them are unable to identify what is happening. Could it be known in simple terms from you, Dr. Brajesh, as to what is it that a panic button must be taken up, or a person must rush to the hospital, and what do you think, in especially in terms of Indians, should be the one thing that everyone must have in their minds?
Yeah, so to ask me regarding the symptoms of what panic button can happen, see, how I explain it to my patient is the cardiac symptoms are, if you talk about an angina or you talk about breathing difficulty, I do tell my patients that the most important feature of a cardiac problem is, in a stable patient, is exertional symptoms. So I do tell them that if you daily walk 3-4 kilometers a day, and suppose in last 15-20 days or last week, you felt that 4 kilometer walking become a very difficult for you, Suppose their house is on third floor and every day they climb 2 3 times, and recently they find that climbing that stairs becomes a difficult. They complain that they have a chest heaviness, they get more tired easily. That's the time that your exertion has come down. Yeah. No, not only that, if a patient says that even his during his routine sexual activity he feels that he has got a chest heaviness, that's a sign that he need to come and show to a doctor. So the cardiac symptoms in a stable patient is exertional, so that is very very important. And if that symptom totally disappears, or at least 95% disappears on taking rest, is again a sign that the symptoms may be a cardiac origin. Third thing, if this is associated with sweating and a sense of anxiety or a palpitations, we call it, that means feeling of your own heart rate. And this has happened, that means a stable patient has recently becomes unstable. Patient used to climb 3 stories every day, but last 15 days there is a new onset of symptom. So that is very, very important. And if the chest pain is, see, many a time we have in telemedicines or patients do call and tell us that, sir, when I sleep, I change the position, I develop a chest pain. Is this an heart attack? So when you tell them that changing the position, touching a particular part of the chest wall, or coughing, or deep inspiration or deep breathing is not related to cardiac, and that pain is musculoskeletal, that is the time when you allay the anxiety and you can tell the patient to come for a stress test or a TMT next day. Now, other than that, if the patient says that he's been finding that his heart rate is very fast, he's feeling very fast heart rate, or if he's feeling that the heart rate is very low, and now the people have got a pulse oximeter and they can record and tell you, that's another sign that the patient has to come and show you. If the patient says that there is a swelling in the body, especially lower limb, that is the dependent part of the body, then of course the patient is getting fluid accumulated. You need to rule out the cardiac part of it. Of course, the kidney is another part involved, which can be a part of swelling in the leg. So need to rule out and take these symptoms very very seriously. Second thing, especially in the COVID time, the breathing difficulty or the sense of breathlessness was very common. But if a patient tells you that this breathing difficulty happens more after sleeping in the night, and I get up in the night after 2 o'clock with a lot of breathlessness, cough, and I feel that everything is congested, I need a fresh air, I need to open my windows, I need to go outside. So that is the time when you feel that this is cardiac. So we call these symptoms in our scientific terminology as paroxysmal nocturnal dyspnea. That means the breathlessness is coming after going to the sleep after 1 or 2 hours. Usually the patients of asthmatic, they will not have this PND, or they may have symptoms, but if the patient is classically complaining that he has got this new onset PND or no new onset orthopnea, that means the breathing difficulty is more in lying down position rather than in sitting position. That is the time you start thinking that this patient has a breathing difficulty, more likely because of cardiac. You need a thorough checkup. So that is very very important. Also, I would like to add that sometimes the patients will have, sometimes the patient will have feeling of dyspepsia, or we call it as an acidity. So that is often confused with the cardiac symptom. So if the patient has got a gastric symptoms, that means dyspepsia in a patient who is at risk group, that means I consider risk group population between 20 to 60 to 70 years. So if that patient has got a dyspepsia which is not relieved by local pantoprazole or rabiprazole, the usual medicines, and if the discomfort is increased by exertion, or if the discomfort is associated with palpitation, anxiety, and sweating, I think that patient needs to be evaluated. So these are subtle symptoms which are often taken very lightly by the population. They don't come and check. If you see all the big shot people who died, either a film actress or something, there were warning signals. They had a acidity in the night. The wife has given this, or the relative have given, tried to treat them locally, and then within 2 to 3 hours, many of them died. So it is important to understand the subtle symptoms of this and take an action on that. So if you have something new symptoms which you may or may not consider as a part of cardiology or cardiac symptoms, I will request you, please make sure you get your health checkup done, show your doctors this thing, because it's very difficult for layman to understand the cardiac symptom that can sometimes imitate acidity, that can sometimes imitate asthma, that can sometimes imitate anxiety. People do say that I felt this is an anxiety, and that is why I did not come. My heart rate was very fast. I felt because of the anxiety, it's happening. What is important is make sure you get down your health checkups done yearly, and make sure that if there is new symptoms, you consult your local doctor or a qualified doctor. I'll say that is very, very important.
Absolutely. This has been a very helpful information that's been given, Dr. Brajesh. Now, having said that, every aspect of health problem can be looked up and needs to be consulted, but there is a huge gap on towards the access of healthcare. Is there a possibility where the mild and moderate diseases can be managed remotely, and there has been an increased reliability on diagnostics tools? So how does this help in determining the heart health? This question I would like to put it to Dr. Amresh Rao. Over to you, sir.
Before we actually come down to what can be managed remotely and what can be managed at the hospital, let me quote a small example. I had been to a health camp for teachers. I've been to a health camp for a teacher group at Suryapet. Suryapet is 140 kilometers from Hyderabad. Excellent road. You can reach Hyderabad within less than 2 hours. There's no, I don't think there's a permanent cardiology presence. Probably there are some people who keep going and coming back. And then when I saw that these were all teachers, and I was amazed to see that almost 80% were either diabetic, hypertensive, or both. And these were teachers. And when I asked them, are you taking medications for these? Most of them said, we are reluctant to take medications because once we start medications, we may have to take them lifelong. Well, are you doing anything with regards to your lifestyle so that you can your dependence on medication is less? Say, there isn't a proper place to walk around. We kind of tend to eat healthy food, but when asked in detail what their idea of healthy food was, nobody really had a clue. So before we are even thinking of what can be managed, I think we have to look at what are the basic things which need to be done throughout the country. If this is the state of Nalgonda, then imagine some village at, say, even more remote, maybe at Satpalli or some Adilabad. The people are not even aware that they have certain diseases, there are certain modifiable risk factors. We are living in such a vast country where reach is so poor. I mean, it starts at the primary prevention itself. And then when it comes to certain diseases, can this be managed? We have seen there is a skew here. People who actually don't have certain conditions, they keep rushing to doctors for vague symptoms. I mean, last 1 year I had so many people who had spondylitis related arm pain who kept checking for chest pain, chest pain, chest pain. And then we have a whole category of diabetics who, despite all their warnings, mind you, only 15% of diabetics will have classical symptoms. And despite all warnings that they might not have classical symptoms, but they have very classical risk factors, they kept ignoring their pains, they kept ignoring their symptoms, and they kept coming and they just kept popping pills for some vague conditions like acidity ho gaya, aaj zyada kha liya, they kept denying that these might be cardiac symptoms. So definitely there is a access problem. I don't deny it. But more than that, there is a problem, as Dr. K.M.K. Reddy mentioned earlier on, there's a huge problem regarding patient education. And now there are so many ways in which access is improved. There's a lot of acceptance of telemedicine. There is a lot of emphasis and thrust, even in the government infrastructure, leave alone the private infrastructure, even the government infrastructure, they have laid so much of emphasis on telemedicine, teleconsultations. They have made the rules and regulations so much simpler. They have protected the doctors also so much from unnecessary malpractice suits. they have conducted training programs during the pandemic, and then uh, various financial models have developed in which doctors get paid for their consultations, and given the acceptance of Paytm and Google Pay and all these things, there's so many ways to ensure that doctors are financially compensated as well. So a whole ecosystem has evolved, and since that ecosystem is evolved, I think at some point, all the stakeholders, be it the patients, be it the providers, be it the employees, or be it relatives, friends, I think the entire ecosystem has to see to it that nothing is missed. Nobody slips through the fingers. It is very important for all of us. So not only should we start with the patient education, patient screening, or making the health services acceptable. Of course, managing these conditions remotely, networking even small ICUs, giving small tablets like aspirin might help save so much of morbidity and mortality as well. So, lot of we have made very good strides. I should say, pandemic has fast tracked what was lying
Mhm.
dormant for so many days, and having made these strides, time is now ripe to consolidate these gains into very meaningful outcomes. That's what I'm feeling it.
Yes, sir.
Absolutely,
So,
absolutely. Yeah, yeah.
yeah,
Please go
sorry.
on.
Yeah. Sir, also one more thing. During the pandemic, we found a lot of people, having a lot of these combinations of, immune strengthening juices and herbal medicines. And, there were like people who actually had boxes and boxes of them. There were a whole lot of them. So, at the end of it, people who had too much of warm water came with problems of the throat and things like that. But what about people who took all these immune therapy juices, medicines, and powders and all that? Did they come back with any kind of problems, or was it just that the body accepted it or the body excreted it out? Dr. Amrish, if you would like to answer, or Dr. KMK Reddy is also
See,
fine.
one of the I am always a very strong proponent, even though I'm a cardiac surgeon, I'm a strong component of conventional Ayurveda and conventional modes of medicine as well. But I'm very much against the way in which it is practiced. See, the strength of Ayurveda is that it gives us a way of life. It is not just chemotherapy. But unfortunately, people have mistook it for chemotherapy, just like the conventional allopathic medicine that you take a pill, you pop an Ayurvedic pill, it's natural and that's why it is safe. Not all that is natural is safe. That is this is one of the biggest misconceptions, and I think the effect is felt more than the cardiologist. This effect has been felt by my nephrology colleagues. So many of people have consumed so many weird concoctions that a lot of them have landed into renal failure. A lot of them have practiced some form or the other of deprivation of water, excessive water, and all these things. Most of them, a lot of them have landed into electrolyte imbalances, and a lot of them have, especially the ones who had borderline heart function, a lot of them have severe congestive heart failures as well. People did follow all sorts of weird things which they should not have. I think they should have stuck to plain, simple, time-tested, practical things. Eat healthy, sleep well, and lead an active lifestyle. There is not much rocket science in it, but people try to probably overdo their interpretation of what our elders had advised us, and that's what got a lot of people into trouble, especially the nephrology people, and especially our post-operative cardiac patients or patients who already had slightly compromised cardiac function. I think they were a bit hit by these things,
Yes,
definitely.
yes, yes.
Yeah,
Absolutely.
Yeah.
I'll share one experience in this. See, there are many people who took a lot of hot water and spicy water in the form of kashayam too. See, some of these people landed with a severe gastritis, severe acid peptic disease, and they had a lot of confusions whether it is because of kashayam or because of heart episode. See, the so-called myths, they were there. Probably those things, I think that was the only weapon many people thought that is only available, even though during lockdowns also all hospitals were kept open for an emergency. But unfortunately, many people deferred coming to the hospital, even there was a life-threatening event happening at home. Unfortunate, sorry to mention this, but it happened. It should not have happened. For this, there are many, many reasons, and many people left are probably left on their own, thinking that there is no, I mean, we should not get out of the house under no circumstances during this pandemic. Let us take whatever that is available, whether scientific or unscientific, let us live with it in an attempt of probably struggling to live. They lost their lives, which was unnoticed, peacefully went. But this is the a big tragedy happened. I strongly believe our India had a huge loss like this. Probably over a period of time, next 10 years or after 10 years, the many stories will come in the form of many novels or many movies also. I don't know, probably that time only people will realize that this was happened like this, and these are the things happened, and these are the reasons happened. Even though there was another blame happened, like all emergencies were not coming to ICUs during lockdown. What happened? Why there was an emergency prior to the COVID? What happened during the lockdown? And this type of discussions also went on. But this happened because the entire morality was pushed down to the society by social media, by many means, or even from their own. Because I'll just mention one more thing. What I feel relevant, when the steering committees were formed, I believe every country policy should have a medical headed steering committees, so that it is a health emergency, it is a medical emergency happened. But unfortunately, it was not focused, at least in our country, that the all the question should be answered by a single contract or a single source. No, it was not happened. If at all the government or somebody has tried to do that, it hasn't reached the people. So people are left with their own strategies, with their own weapons, with their own style, with their own myths or whatever the knowledge they have. So they all these things costed many lives. This is a very big tragedy, and probably these are all the big lessons all of us should realize, and probably based on all these postmortem issues, we have to pass on a healthy things to the future society, so that the probably we are doing, apart from a routine work, we are doing some a real a human service for a future generations.
Thank you, Dr. KMK. Before we come to an end of this session, Dr. KMK, though there is an increased efforts from the government in regards to communication information, should there be a defined information system or sensitization system? And you have been the president of Telangana chapter cardiac surgeons chapter. Anything that government needs to take up very seriously in terms of integrating certain system for the sake of the healthier public overall holistically?
Yeah. See, the important concept which I think which is relevant in this is, see, whatever that is past, we have to learn from the past. Unfortunately, we killed 2 years time. We learned probably 20 years experience in the last 2 years. See, the our probably the infrastructure, the attitude of the people should definitely go in a positive direction. We have to build a good infrastructure, and more than that is the attitude of the stakeholders should improve positively, including the policymakers. Then only things work out positively, and everyone should feel it is a fundamental responsibility to talk about a preventive health, including the heart health. The preventive. Even though there is a saying that an ounce of prevention is better than a pound of cure, but rarely put in practice. So we have to revitalize all these things, and we have to probably shortlist the what are the deficiencies found, and we have to improve on a footing basis so that we can mitigate this type of scenarios in future.
Thank you very much, Dr. KMK Reddy. And there is one question that I would like to have the view of Dr. Pradeep. As the heart health has come to the limelight, especially during the COVID-19, and also when actors like Puneet Rajkumar from Karnataka and another actor Siddharth Shukla and others who were basically understood to be very fit. And there is a mistaken understanding that someone who looks fit is also fit in term heart health wise. What is your message for those youngsters and young people towards this misconception? What do you have to say?
Um, Visible physical fitness need not necessarily mean cardiac fitness. A strong muscle need not mean strong heart or healthy heart, because cardiac health or our risk depends on few invisible numbers which we can identify only by testing ourselves. When I'm saying this, I'm talking about we need to know certain numbers. Say, for example, about ourselves, I should know what is my blood pressure. I should know what is my cholesterol numbers. I should know what is my sugar numbers. So these are few basic stuff we should know about ourselves. It cannot be visibly recognized, and uh, I strongly urge everyone who is 30 plus to undergo at least a basic evaluation to know these numbers. And if they are normal, well and good, keep checking yourself periodically, at least once in 2 to 3 years. If they are borderline, take precautions, follow under the guidance of your doctors. If they are grossly deranged, uh, do take necessary action at the guidance of your doctors.
I think
Thank you,
I'll
Dr.
add, for with that, I'll add one, I'll take another 10 seconds. See, the definition of a health by WHO is physical, mental, social, and spiritual health. So all these components are very much required to meet the definition of a health, including the heart health.
Sir, and to add to it, not merely the absence of a disease as well.
Correct, correct. You are right. You are right. Yes, yes.
Yeah,
So
so we have got the views from Dr. Pradeep, Professor Dr. KMK Reddy, and Dr. Amrish. Dr. Brajesh, would you like to give a message before we end this session to the general
Yeah,
public?
see, I do tell these lines to all my younger patients, and I tell them that to have at least three passions in life. I mean, of course, I do tell them what Sir said about the numbers. We should remember our numbers. Second thing, tell them to that every day they need to exercise for 45 minutes. If they don't exercise, that is getting added, and at some point of the time that added minutes or hours you will have to spend for your health in the hospital or in the ICU. So that is very, very important. So every day you have to pay back to your body 45 minutes. Third thing, I do tell them that to have at least three passions in life. People say एक passion होना चाहिए life. I do tell them three passions. One is, of course, what you do in your profession. You want to excel in your profession. You are a doctor, you are a cardiologist, you want to do well. So if you are not a passionate in your profession, you will not excel. Second thing, I do tell them that you should have one sports in your life, that passionate. So if you are sitting in your OPD, it should be there in your mind ki today evening I'm going to beat that fellow in a badminton. Today evening I'm going to do this thing in our sports. I'm going to have a good cycling. I will going to have a good, third passion. I always say that one thing, something like a singing, painting, gardening, having a pet animal, cooking. So these three things: one physical, one, something which brings music or something in life. Third thing, of course, your profession excellence. Try to improve as much as possible. So I feel that is what balancing is required from for our youngsters. See, we were not born to sit in front of laptop. I mean, if you see our ancestors, they used to kill, they used to go for a hunt in jungles and, get that meat. They used to climb trees to get the fruits. What has happened, we, at that time, if you see, even when I started my MBBS in somewhere in 91, 92, at that time also, we hardly used to see heart attacks. If one heart attack will come to the ICU, we all will go and see the ECG, what is happening, how is the heart attack, who is thrombolized. But what is happening over here is now half of the ICU is admitted under me. That's the situation. So, what is the reason for that? Your kid is in 10th class and you start stressing him for an engineer or doctor post, isn't it? So that all those things, lifestyle, we need to change. We need to we need to make sure that we continue our passions. Whatever passion you had in your school life should be continued in your college and then post college also. If you were a good badminton player, please continue badminton even now. If you're a good singer, please continue. Get a karaoke at home. Start singing. Make a group of people and let's join together. Have a picnic together and singing. So that is what is more important. I think life has to be lived in a proper way, and stress, I feel, is the most important. Most important. Okay, just to add a few seconds more. In my hospital, we have a small coffee club, and that room with the coffee machine is there just in front of my OPD. After seeing every 3-4 patients, I do go and sit there, meet people, we laugh together, come back, see another 5-6 patients, come back, another 5-6 patients. That is what we do it. And on Sunday, we have our Fortis Hospital, Navi Mumbai, has organized a picnic for doctors. Can you imagine? We are going for a picnic, and no, you cannot take your own vehicle there. The hospital has booked 2 buses, because the place where we are going for a picnic is not far. It's very close. It's 1 hour journey. Many people may prefer their car, but no, here we are going with the bus, so that the time spent inside the bus. And I feel stress need to be taken care of. We need to have more friends. You need to call your neighbors to your house for a tea, and we should visit them. You should be very close to all your colleagues, friends. We make sure that every day, or at least every second day, we give a call to our batchmate, schoolmate. Kya chal raha hai yaar? Give a local colloquial, some abuses. It gives you make you free. That is what is important. So I feel that is lacking in our life, and that is very, very important.
Absolutely, Dr. Rajesh, and a very good message and the practice that's been taken up by your organization. And there's a strong message. Give your physical exercise or activity time right now. Otherwise, be prepared for spending time in hospital or treating the disease. So, with this, it has been a wonderful and a vibrant, very fruitful discussion. We are thankful to all our esteemed speakers who have joined us from across the country. And with this, we would also come to the end of our day one of IndiGlobal Healthcare Summit. So, as a token of appreciation, we would like to present speaker certificates to our esteemed speakers. So, we would start off with our first speaker. Our speaker certificate proudly being presented to Professor Dr. KMK Reddy, who is the Senior Professor Cardiology, Osmania Medical College, and Senior Interventional Cardiologist at Apollo Hospital, and past President of Cardiac Surgeons. Thank you very much, sir, for joining
Thank
us.
you.
A round of applause. And we would present our next speaker certificate to Dr. Amresh Rao Velapati, who is a senior cardiac thoracic vascular surgeon in the NIMS Hospital in Hyderabad.
Thank you so much.
And we would also like to proudly present the speaker's certificate to Dr. Pradeep Karnahalli, who is the consultant interventional cardiology Manipal Hospital from Bangalore, Karnataka. Thank you very much, sir, for joining us.
Thank you.
For valuable inputs. And also, to a doctor from Mumbai, Maharashtra, Director Interventional Cardiology, Fortis Hiranandani Hospital, Vashi, Dr. Rajesh Kumar Kumar. Thank you very much, sir, for joining us. It's been a wonderful session. We have delegates have joined us through this 3D virtual platform. At the same time, we have gone live in several social media platforms. We would like to thank all the delegates. And just to tell you all, these live recorded sessions will also be available on IndiGlobal TV. All of you can go and rewatch it. It is a very, very important session, and we would also be coming up with a conference report that we would be printing in our next edition of IndiGlobal H Factor magazine, and it will reach to you all soon. With this, I would like to thank all our esteemed speakers. Any words from you, Kanisa?
Yeah, thank you. Thank you very much, all. And it has been a
Thank you.
wonderful session and a very good message to people. Thank you. Thank you, sir.
Thank you.
Thank you, all of you, for joining us. Thank you, sir.
Good luck.
Good luck. Thank you, sir.